vaccines, because in a record time period, at least the researchers were able to deliver something. Was a Herculean effort, truly commendable. This has never happened in the last 100 years. In fact, the only thing which sets us apart 100 years before Spanish flu pandemic and now is actually the vaccines. Nothing much has changed. So the vaccines are there as an important, in fact, of paramount importance ammunition in our basket to be able to wage a war against corona. The dosing regimes have been an issue, right? Because I don't understand it all too well. Because there was one time when they said strictly 3 weeks, 4 weeks, and then went on 4 to 6 weeks, then 6 to 8 weeks, and 8 to 12, then 12 to 16. Now, 12 to 16 was sort of promulgated, and today morning we heard from UK, the PM saying that, in fact, because of variants of concern, they are truncating from 12 weeks to 8 weeks to 50 plus individuals. So that again throws up a challenge that we have science on one hand, we have practicality on the other hand. Are we actually mixing them both? But do we have a choice? We probably don't. We still have to walk that tightrope here. So thereby, what is it as a citizen? What is our responsibility? I always tell my people, my patients, whether multiple sclerosis, stroke patients, people on aspirin and other antiplatelets, anticoagulants, we get these questions even now. Should I take a vaccine? Should I stop my drug? What will happen if I take a vaccine? In fact, before I joined you, we had 6 calls, again coming from my MS patients, that I'm on immune modulation, I am on steroids, I'm on mycophenolate. What do I do? Do I take a vaccine? Will you guarantee me that nothing will happen? So I tell them, okay, you choose between a side effect of vaccine versus corona. Now, because we cannot tell you 100% guarantee nothing will happen, but I can 100% guarantee that there will definitely be a protection. Will the protection be 100%? No. But do you want to choose between some protection versus no protection? That's a no-brainer again. So between the dosing regimes, ladies and gentlemen, I have my doubts. I think the extensioning the time window frames will probably still be of concern, and we'll probably get more clarity later. But said that, there has to be clarity in your deliverance. Now, I just heard again from down south, and I think part of Tamil Nadu and part of Karnataka, who said that when we have vaccines, we're going to prioritize the second shot for 45 plus. But that sort of contradicts when you say your dosing regime can be up till 16 weeks. So there needs more clarity on that. But I would leave it to, again, policymakers and implementers on that. But in the basket of choices, now I'm going to have Sputnik V also in it. We have Sputnik V Light as a one-shot vaccine. We have Covaxin. We have, of course, Covishield, and maybe others which will descend some point of time. I heard about Zydus coming up with another DNA variety of vaccine, which is just a skin patch, which is of a welcome thing, that there is not even a shot, so you don't need a medical personnel to inject that vaccine, which would be welcome. And of course, you have nasal sprays, Covaxin. The Bharat Biotech is working very seriously on a nasal spray. And then we have pregnancy, lactation, and children. So we have again a welcome news about the phase 3 trial in children between 2 to 16 years getting Covaxin. In fact, in AIIMS Delhi also, we started this trial. So there is a lot of push, and already we know that it is being implemented in the US and others 12 years and above. In fact, in India, we've gone down even closer to, the younger people. So it is 2 years plus. So if this trial is fine, that from 2 years upwards, we'll be able to vaccine. Pregnancy and lactation is a different ball game. And I want to touch this a little bit. Do we have data of pregnancy, lactation? You see, traditionally, whenever you have a trial, they exclude pregnancy and lactating mothers. It's a traditional concept. And they're always looked into as a separate group. But then now we know that in the first wave, for some reason, this population was sort of saved. We didn't have too many of young mothers, nor did we have young children. And now we know the second wave is hitting these people. We've had these. We really have seen it in front of my eyes. I have seen this. And it's terrible. If I talk of mental health issues, the first thing is I have to get my mental health up and running, when living amidst all this kind of desperation and desolation. So in this, there is a hypothesis now that you can vaccinate a pregnant woman. And in fact, in a lactating mother, the antibodies can go to the feeding infant, and that would help the infant as well. And this is actually being told by my director from my institute and a lot of other scientific people as well. So it seems that pregnancy, lactation, when we come to that, probably should also be vaccinated. Do we have a grade A recommendation? No, we don't have a grade A recommendation. Do we ever get a grade A recommendation? I don't know. Because again, we are looking at practice versus pure science. They need to actually mingle into some kind of, again, a tightrope walk. Children, yes, probably in a few months now, we will be getting a vaccine. When the rest of the world has already started off, I don't think India would be far behind. But when we all have these many choices of people to get vaccinated, we already have the comorbid, we have the elderly, 60 plus, then 45 plus, and now 18 plus, and now we know even children and pregnancy. Do we have the number of vaccines available? Right now, none. Because our vaccination program has hit a roadblock because numbers are again huge. When we definitely, their numbers are so huge that people have compared and contrasted countries to a single state vaccination program or single district vaccination program. So how do we do that? Now, we've been told recently that we will be getting about 2 billion vaccines by the end of December because of, again, a basket of vaccines, and we would have a choice. Maybe we will have hope that we would. But then how are you going to get that into people who need them? Well, the current system wherein the people have to register onto an app, go to a particular place and get vaccinated, would that be? Currently, we are seeing that these are, in fact, big COVID spreaders. These are becoming COVID spreading behavior there in people who are going to get vaccinated. They're crowding there, and there are issues there. And you only have limited number of centers and limited number of vaccinations. What we've learned in the first wave is that originally we were very scared. Each person used to be observed for half an hour and looked into, and we've seen that over a period of time, not very many need hospitalizations, not very many have problems after vaccination. So we know that immediate post-vaccination, maybe they really don't need to be, made and observed. If that's the case, which is a system which will work? Get the electoral system. And I'm sure you have people there in your, maybe some who are listening now, that when you have electoral system, you can reach out to the most interior parts of the society. You're going down to each person who is going to give you the vote, who's going to go and give the vote. That is where probably you need to get that system in place to get the vaccines even done. Go where you already have an established system. We have a well-oiled vaccination system for our oral polio. Get that system in place. Use people who are there into interior society. And I don't think the current system of registrations, those who can register, get a slot, get to a designated place, will be able to deliver it by the end of this year. So we hope that for all of us, we have a role to play. And the last part of the mental health issues. Again, I'm coming back to the same thing, that yes, mental health has been a major issue. I haven't even talked about the neurological complications of COVID, because that would be a 1-hour lecture. I'm talking about it too in one of the Indian Medical Association programs tonight, that we're seeing a whole spectrum. We've published this data. We've had brain attacks presenting without any influenza-like illness, whole spectrum of neurological issues. And the more important thing that we're seeing is in COVID survivors, there's a big universal research program looking into not just headaches and mental fog and confusion. Survivors over a period of 6 months, 1 year, 1.5 years, do they get affected with some degenerative disease, because there is a strong hypothesis and also a proof that there is an entry of virus into the brain. But the mental health is the pillar probably which will help us all stand and fight the war. And in that, there is nothing easy. It's very easy to say, do yoga, do pranayam, sit and think of positive thoughts. But I feel the mental health issues will be resolved only when we collectively help out each other, because it gives you so much of satisfaction when you actually help one another. And you don't really have to go out into the community. I come out into the community because I'm a doctor. I won't sit at home. I'm right now in the hospital. I've done the morning ICU. I'm here with you. Now I'll go back to the wards. That gives me the satisfaction because that's my role to play. So there is a safety factor. I do wear my PPE. I do wear the mask. And when I'm outside, I leave the house. I go to my home. And the first thing, I take a bath, then enter my home, and I'm careful when I deal with my family. That's my responsibility, but I'm not sitting at home and living in a bio bubble, because as a doctor, I have a role to play. And each one of us, if we play that role and have the COVID appropriate behavior, the mental health issues will also be taken care of. There's so much of happiness and satisfaction when you play your role and help one another. And I'm sure the end game would be in sight, and amen to that. Thank you.